I'm Patrick Quillen, and you and I are getting healthier together. Just sipping a cup of green tea, thinking about the whole business of healthcare in America. Let me give you some numbers. 315 million Americans, 700,000 allopaths, MDs and DOs, who are primarily in charge of the healthcare of those people. The budget we're spending right now is $2.7 trillion a year, and for that we are ranked 35th by the World Health Organization in our general health statistics, and that's neonatal survival, longevity, cost and suffering of the people. So we're not doing well. The return on investment is not good. I'd like to share with you the whole idea of, is there any evidence to say that nutrition can help? I gave a presentation once at a major hospital in San Diego, and afterwards a physician came up to me and said, I just got out of medical school, and they told me in medical school my nutrition education was that you can get all the nutrients you need from a meal at a fast food restaurant, and that gives you the 4 food groups. And that was the end of his nutrition education. It's kind of lamentable because there's so much evidence on the subject of nutrition. I'm going to a conference this weekend on the subject of supplements, an evidence-based approach. Let's talk about the evidence. For instance, arguably one of the most heroic efforts in this whole field, nutritional medicine, Alan Gavey. A good friend, a brilliant guy, a medical doctor, and a master's in nutritional biochemistry. This book is 1,300 pages and 15,000 references. It's extremely well documented, and it basically says that food and supplements can prevent and reverse many common ailments in America. We move on. A good friend, Dr. Michael Murray and Joe Pizzorno, have come up with another set of books, and this is an Encyclopedia of Natural Medicine. My own humble effort in this field, Healing Nutrients, which was published back in late 80s, and is basically saying there's an abundance of peer-reviewed evidence to support the use of food and supplements to prevent and reverse many common ailments. And we'll come back to the whole business of risk-to-benefit ratio. Physician's Desk Reference, another good friend, Dr. Sheldon Hendler, MD, PhD, who wrote this book. Again, thousands of references supporting the use of nutrition supplements. Nutritional Influences and Illness, Dr. Mel Werbach, a good friend, a brilliant guy. Again, another effort at gathering the data from the National Library of Medicine, showing that supplements can help. Disease Prevention and Treatment, this is from Life Extension Foundation, a very good book. What I'm sharing with you, there are others, but here's the deal. Risk to benefit to cost ratio. Anytime you make a decision, think about this. You say, well, if I get up in the morning, it's kind of what are the risks? I might get hit by, in a car accident. But if you don't, you might lose your job. That's the risk. The benefits are getting a paycheck, working with your fellow workers. So you look at risk to benefit to cost in almost any decision. In America, we look at someone who needs, let's say, they have inflammation of the knee joints. And rather than looking at supplements first, the risk to benefit to cost ratio is heavily in favor of using that as frontline therapy before you do knee replacement surgery. I'm not against drugs and surgery. All I'm sharing with you is there's thousands of studies to show that nutrition should be frontline therapy in many people's ailments, not in emergency medicine. If you're in a car accident, go straight to an emergency room, and you're in the best care in the world by being in an American ER room. But when it comes down to long-term chronic ailments, chronic degenerative diseases, heart disease, stroke, diabetes, Alzheimer's, many autoimmune diseases, liver and kidney disease, with many of these conditions, nutrition can be a very effective therapy as frontline therapy. I'm Patrick Quillen, and you and I are getting healthier together.